these tools will only work if they're designed as additive tools that give us another view of something. So the same way as a microscope would have added another view, the same way that an MRI adds another view, it's not taking away. I think it's more similarly to all of these tools. It'll be adding more ways how to look at things. Hello, hi Hiba, welcome back to Changing Shapes and the Wish I Thought of That segment. How are you?
Good. I'm good. It's always this funny moment in the year between Thanksgiving and the holidays where everyone's like, everything needs to get done. So I'm ready to put all of that on the side and talk some product. So yeah, that's me. How are you doing?
Awesome. No, that sounds good. Yeah, it is a fun time of year. I'm good. We had a funny little life experience. I was really proud of our little puppy who's milling around in the background there.
Hmm.
And she's 7 months and loves to play with every dog. But the other
Hmm.
day we were doing some work, some dummy training, and this dog
Hmm.
came around and I thought, okay, she's going to want to play, so we can take a break. The dog came
Yeah.
over and she's like, leave me alone, leave me alone. I'm busy here. So she's like, she's already into the rise and grind mentality at a 7-month-old puppy, which I'm pretty cool with. So I was very, very proud. She's a good little one. So that was quite a fun one.
Oh, very sweet, very sweet. Alrighty. So tell
So
me.
yeah, so today, in our little mini series about health tech, I wanted to dive into data analytics in health tech.
Mm,
And for this episode, the way I wanted to approach this was through the human perspectives. So the patient's and clinician's perspective, because
mm,
that's my area. And I will be inviting some people who are building these tools to get their perspective from behind the scenes of what they're building. But I wanted to
nice.
take it from a consumer and clinician perspective today.
Awesome. I'm very intrigued. I'll admit it's not an area I know I have a lot of firsthand experience on, so I'm going to be learning a lot from you. But I think it's more than ever, especially coming out of pandemic times, etc., and all this big kind of wearables boom that we're in. I think this is a very kind of important topic that a lot of product folks should be plugged in on. So I'm super curious. Let's go. What's been sparking your brain these days?
Yeah, so I think as you kind of already alluded to, there's a shift that we're living through. So I think
Mm,
for most of healthcare history, the structure was pretty simple. So you'd get sick, you'd go see a doctor, you'd get a test, and then you'd get a
mm-hmm.
treatment, right? So it's quite
Mhm,
linear on that level. And I think
mhm.
today the rhythm is changing quite significantly. It's more like you live, you generate data, patterns emerge, risk becomes visible, and then action can happen earlier. So it's
Okay.
more of an
Mhm,
ongoing thing that you're getting, which
mm,
you do
mm, mm.
get in some situations with healthcare, of course, but that's becoming more of the shift to the norm. And so in a way, it's almost like you're able to have, medicine before medicine and diagnosis before disease and just
Right.
being able to act a lot sooner and be able to just have an intervention before there's a crisis.
Mm,
And I think, like you say, with wearables, Apple's shifting the dialogue with actual clinical analysis. Like I think they're doing atrial fibrillation and hypertension right now. And that's, they're putting that front and center in their advertising. So it's becoming a lot more normalized that we sharing our data is
mhm,
something that can be really good for us. And I think they're leading the way in terms of the public perception of it. But then there's a lot of
mhm,
players a bit more in the background that are doing some amazing
mhm.
things that go really deep.
Okay, okay. I like that the way that you just said the diagnosis, like our approach to kind of taking our health into our own hands and identifying potential areas of risk before it becomes critical, that's become so normalized. I actually haven't thought of it like that because all of those decisions, etc., are happening outside of a doctor's office, if that makes sense. So I think, but and for me, the insight, like as a product person, which I don't think I connected the dots on before, is that it is really part of this larger medical kind of I want to say experience workflow. And it totally begins with a person firstly understanding what they need to measure, how to accurately measure it, how to read those results, and then how to also be a better advocate for themselves with a doctor. So there's many kind of layers of education and trust building and all sorts of things that come into play, which is obvious when you think about it. But, thinking about that in the context of a larger medical, I don't know, journey, experience, however we want to call it, I think also just changes the gravity of those aspects of the user experience when it comes to wearables, etc., that I don't think I fully had understood. So, yeah,
Mm.
I think that's a super super good to start the conversation on.
Yeah, I think you touch on a really important point there, that it is becoming more normalized. And so you mentioned that, so looking at it from the patient perspective and what people see
Mhm.
happening, you have, like you
Mhm.
say, wearables, you have symptom
Mm.
checkers in apps,
Mm.
you might have
Mm.
home tests, you might
Yeah.
get like detailed blood panels and a bit more information on that. I know some people who get detailed blood panels and then they feed it into their AI of choice and see what that says, which, whether that's good or not is another question. But like, we're becoming a lot
Mhm.
more desensitized to that data, and
Yeah.
there are more full body scans popping up that you can get. And I think the evolution of electronic health records and those becoming more integrated in various
Mm.
countries
Mm.
is an interesting evolution too, that just people have
Yeah.
more awareness of. And
Yeah.
I think people, I mean, and me included, see the promise that can come from this. So you might be able to
Mhm.
catch things early. You might be able to get better personalized guidance, right? There's so much information about how different people process different things we eat and what that means.
Mm.
It gives you more
Mm.
control over your health and more visibility of where you are. And in a way, more understanding on what I can do to take my health into my own hands. But then there's
Yeah.
the flip side of it, which is there's also fear, right? So who sees my
Yeah.
data? Will my insurance see it? And will that affect what I have to pay my insurance company? And
Yeah.
will the data analysis be right? Or could there be some false or negative positives? And in
Mm.
a way, there's a question of, do I want this level of visibility to myself? So for me, I don't know how you feel about this, but for me, I wouldn't want to do a DNA test to get any potential risk evaluations that I might have without somebody who I trust that can sit next to me and explain what that
Mm.
means.
Mm.
Because if you
Mm.
just read it as somebody who's not a clinician and maybe not a statistician, it
Yeah.
might be really terrifying. And also, you'll have
Yeah.
information that you may or may not want to deal with. So I'd want somebody alongside me that
Mm.
before I even take a DNA test like that and get that kind of
Mm.
data, that will help me understand, well, what information can I get? How will that affect me in my life, potentially?
Yeah.
And what will I deal with it? And then how to understand it once I get it. So
Mm. Mhm.
in a way, it's the most private data we have about the most important subject we can think about, which is living. And so
Yes.
it takes the stakes of trust are higher than anywhere else, and so are the upsides.
100%. I can't I think it's the most important data because it's about you, it's about your health, it's about longevity of life, quality of life, all of these things. I think if you connect with a cultural kind of like moment we're in, it's people, a lot of influence out there are promoting kind of like, or at least in my feeds, how to, take your health into your own hands through diet, through exercise, through kind of natural means, meaning like without kind of a medical or chemical intervention. And it's interesting because it's such an important aspect in your life. I feel like people also are like, if there's a problem, I want to know about it and I want to be able to know, can I take action on it as
Hmm.
quickly as possible? So for sure. The whole thing of like don't Google your symptoms because you're gonna get a WebMD page and you're gonna find out that you have something terrible. Funnily enough, when you connected with AI, you connected with this whole like, kind of like the doctors, you can be your own advocate. You don't need doctors necessarily. Diet can fix a lot of things. When you put all of these things together, I think people very much like feeling empowered with that information. A doctor all of a sudden looks like a gatekeeper. You don't have to go through all the money, time, friction. You can just listen to Andrew Huberman and put your blood panel results through ChatGPT and kind of connect some dots on your own. You're smart, you have a brain. So I think people are very inclined to kind of take things into their own hands because they think that it's more empowering. And I think in many cases, one could say there's some truth to it. But from a patient perspective, I wonder, yes, sorry, you have to trust the data, but I wonder what the impact is overall in trusting the medical process also, right? Because you want, at the end of the day, everyone wants good outcomes. Everyone wants to, as much as possible, be preventative. But I think that's what comes to my mind with all this new data that's available that patients or people can now use, access, and interpret on their own.
Mm.
Maybe a negative feedback loop is more trust in data and in software, but maybe less trust in the medical system. I don't know. Maybe that's a step too far, but that's the smell that I get.
Yeah, that's actually a really, really good point. And I think there is a huge difference there between, oh, I'm just gonna collect some data that I can get from my doctor. I get a blood
Mm,
eval and I just upload that
mm-hmm,
and see what comes out. And then,
mm-hmm.
I mean, I think there's for a lot of doctors, I think and I try to avoid being this worst patient who is like, oh, I already know what I have. I Googled it, right? Like,
Yeah,
Googling
yeah.
something for 5 minutes is the same as going to medical school for so many
Mm-hmm,
years.
mm-hmm,
And, it's well intentioned in most cases, I think. But
mm-hmm,
it's based on curiosity,
mm-hmm,
but there's an element so my behavior in this area is, yes, I want to get informed and I try to get information from trusted sources, but I'm
mm-hmm,
always humble enough to know that I don't know anything. I'm just some dude that read
mm-hmm.
something on the internet or maybe in a book. And I think they're finding the trust to say, and that's why with these DNA tests, I want the doctor to be the gatekeeper because I don't trust myself with that information. And so
Yeah.
that's the interesting point where patients are getting used to having data and dealing with data and giving the data. But you're right, it can also lead to people informing themselves and coming maybe with a strong opinion about something, which isn't always bad. You know your body really well. But I think having the ability to present the information both as a human as well as with these tools
Yeah.
that allows you to understand, what am I looking at,
Mm,
right? So you might have data analysis
100%.
that is
Mm, mm, mm,
suggesting something. What does that
mm-hmm.
actually mean? Does it, just because Google says that with this list of
Yeah.
symptoms you have this disease, well, did you travel to a country where that disease actually exists, right? Is an obvious question.
Yeah,
You
it's
know,
it,
and
it's a lot
and
of pattern recognition that needs to be happening as well as just straight up interpretation of one data set, right? And one set of variables. I think there's the patient's perspective and then there's the clinician's perspective, right? And I think, it's important to look at it from both sides, especially when it's a multi kind of faceted experience like this, one has to consider how the tool and how the data is being used from both sides. I think I would be remiss if I didn't point this out when it comes to a patient perspective. We're kind of generally talking about illnesses, disease, sickness, but the intersection of like women's health is
mm,
also important to point out. I point it out because it's not about, sorry, historically, there's very little research done around women's health and women's health topics. Like I can name like PCOS, for example.
mm,
Like it is known that there is not enough studies done on the condition. Doctors know very little, and so doctors end up prescribing, diagnosing, and connecting dots in a very limited way because there's very limited research to base this off of. What I'm trying to get at though is the tools and data in this case, in the context of women's health, really is important when it comes to education. And it's
mm-hmm,
about understanding all the nature of the condition without diagnosis, right?
mm-hmm.
So
Yes.
I don't want to dwell too much on that right now, but I think that's another aspect of the patient perspective, right? There's detection, diagnosis, but just straight up education. And when we look at it that way, then maybe the technology has a very clear place in the experience and empowers the patient without doing the doctor's jobs for them or misdiagnosing or connecting the wrong dots, etc. But I think I think now I'm really curious to hear from like a clinician's perspective. Where do you think, like, what do you think are their biggest concerns when it comes to bringing in new tools into like their workflow for diagnosis and whatnot?
So, in terms of the clinician's perspective, I actually talked to a friend of mine who's working in the space, and he explained to me a little bit more the context of clinicians' expectations. And in a
Mm-hmm.
way, on a top level, clinicians don't want AI that's smart, they want one that's safe. And there's so many things to consider there, right? So,
Mm,
things that they want, not necessarily from looking at this from a technological perspective, but what do they want from a tool? They maybe
mm,
want a
mm,
second pair of eyes. They
mm,
want a different type of structured thinking. They want
mm.
fewer missed patterns. They want less liability, and they want tools that support but don't override them. So, and then on top of that, we're talking about clinicians, and that is such a broad term because every
Yeah.
specialty will have its own world, right? So,
Mm-hmm.
cardiology isn't the same as dermatology, isn't the same as oncology,
Yeah.
et cetera, et cetera. So,
Yeah.
generic tools are unlikely to work. And when there are tools that do go beyond a certain specialism, they have to adapt to these different worlds. They have different languages,
Yeah.
they have different
Yeah.
data points, different metrics and
100%.
outcomes, and even outcome
100%.
durations. So
Mm,
one of the
mm,
biggest concerns for new tools as well is that they
mm.
don't add work. And what clinicians value are tools that allow them to see more,
Yeah.
save time, and reduce
Yeah.
risk and not do their
Yeah.
work for them, or worse, to add even more admin.
Totally. I mean, that totally makes sense, right? I think you're right to point out that every speciality, medicals like kind of focus, they have different terminology, different variables that they're focused on. There's no one size fits all for sure. I can't help but think, and again, this is like just a technologist abstractly saying something that might to a medical professional might just be like, yeah, you don't get this at all. But I I think about like just pattern recognition, right? Because everything you're saying about reducing admin, not doing the work for you, enhancing what you're already doing, that totally makes sense. But then my question is, from a tool perspective, if you approach it as building something bespoke for a certain discipline, are you potentially reducing the capacity for the clinician to kind of see a wider pattern, right? If I'm connecting, sorry, actually multiple thoughts at the same time. I can't help but think of these medical shows like House
Yeah.
or Grey's Anatomy or whatever, where, there's just like, wait, I remember that this person actually went to the park and it's springtime and the pollen, this person has a deadly allergy. It's just the most ridiculous kind of connections get made from what are seemingly random pieces of information across the show. I'm just saying, also from lived experience, there are so many variables that can affect your condition.
Mm.
And I think I'm gonna just put a really big pinch of salt on what I'm saying. From a technology standpoint, how does one reconcile the fact that specific disciplines need a specific set of tools, specific workflow, specific language? How do you reconcile that along with the need for wider pattern recognition? Because I mean, I don't know. I think I feel like I have heard, read, seen, like that's one of like people kind of pitting AI or LLMs against like human pattern recognition. I would never say that an LLM shall replace the role of a doctor in connecting dots like that.
Yeah.
It connects dots based on what it understands to be the most logical patterns, but humans are amazing and wonderful and weird that way. We think out of the box continually all the time. So I'm not trying to compare the two. But it is objectively true that LLMs can do pattern recognition faster over a wider range when given the right inputs. So this is a ramble and a way of asking from a clinician perspective, like, do you think one thing we might lose in the effort of having like a really more operationally efficient and helpful tool, we might lose some of that wider pattern recognition, those opportunities?
I don't, not at all.
Mm-hmm.
And I'll get to it a little bit in my
Mm-hmm.
takeaways for this, but I don't think at all because it's supposed to be, and these tools will only work if they're designed as additive tools that give us
Mm-hmm.
another view of something. So the same way
Mm-hmm.
as A microscope would have added another view, the same way that an MRI adds another view. It's not taking away. I think it's more similarly to all of these tools. It'll be adding more ways how to look at things. And
Fair,
the job
fair.
of radiologists didn't exist until we invented those tools, and it's expanded what we can do as clinicians. But I think the human side of things will never go away. Besides, it won't be not being adopted if it's not designed as an additive tool. It won't work as well because there's still, thankfully, we'll never be able, well, at least I don't believe that we'll be able to replicate the human brain. If we do, then we have a whole other list of problems. But I think on that level, these tools will always be an addition that look at things in a different way, and humans will not only be needed, but will be adding a lot more.
If you're designing for trust and you're trying to
Yes.
build trust between the patient and the data, the patient and the doctor and their data, and all the things, you kind of need to keep in mind what's the mindset with which somebody might probably be coming in and looking at that data for the first time. As you already kind of said that earlier, like you might just do a DNA test and then feel extremely like fearful and afraid of like what those results mean. How do you kind of proactively anticipate that and prime the person better and instruct them on the next steps? I think within a tension point that I'm kind of hearing, not tension point, but something that I notice is that technology likes to move fast. Technologists like to move fast, prototype, fail quickly, fail often, all of that. And when it comes to tool adoption and coming up with ideas, like no one's short on ideas, but there's a reason why it's really hard to build tools for medical practitioners, for clinicians, because it all feel that their whole approach and towards in relationship to risk is very different. So that's also an interesting kind of
Yes.
clash, I guess, of when it comes to innovation and product adoption. Of course, in the medical field, there's so much innovation when it comes to physical tools and imaging and all these kinds of things. Of course, we're looking at it really from a software perspective, but yeah, what do you think about that? That kind of like clash between, like, let's say, technologists and medical practitioners.
Yeah, I think for really good reason, the healthcare space isn't a product market, it's a risk market.
Mm,
I
mm,
want these places to move slowly because
mm,
failure isn't a learning loop, it's harm. And
yeah,
the companies that are working in this space, they need to, everything that they do needs to have evidence. It has to have approvals. There has to be, very careful integrations and
yeah,
liability alignment. And I don't want to be on the wrong end of moving fast and breaking things at
yeah,
a health tech company.
yeah,
And so
yeah.
I think innovation has to move at the pace of safety.
Mm,
And it's a system that doesn't reward speed, it rewards
mm,
certainty. And there's some examples of companies that, in my research have popped up as really interesting in this space because,
mhm,
and maybe just to take a step back from on your point of trust and how we're here and moving slowly, which all plays together.
mhm,
The reason why we're here is that we have had about a decade of digitization with electronic health records. And now the decade that we're arriving in is the one where we start to look into those patterns.
mhm,
And the
mhm,
cultural shift of us accepting our data to be used in this way is slowly emerging, and we're starting to see the real benefits of it. And so
mm,
that's where these intelligence layers can emerge. And in a way, this is really different to the consumer AI hype. It's
mhm,
clinical pattern recognition. And so some of the companies that I really, there's so many that I could list, but the top
mm,
three that I've just wanted to highlight are See the Signs, which I
mm,
think I talked about them in the previous episode. They do pattern detection in primary care where they use symptoms and
mhm,
risk factors and demographics to help clinicians catch cancer risk really early. They've
mhm.
had 65,000 early detections so far,
Amazing.
and they give reasoning, guidelines, and evidence and help
Mm,
people. The earlier you catch a potential cancer, your
mm,
survival potential increases. Or let me
yeah.
say it differently, what they do increases the survival of patients because they provide early detection. And that's,
Mm, mm,
that's brilliant. And they've integrated into the NHS and are expanding in the US
mm,
at the
mm,
moment as
mm,
well.
mhm.
And their work is only
Amazing.
possible because of electronic health records.
Yep, yep.
Another company is Viz.ai. So they do pattern recognition in CTIs and MRIs. They can detect
Mm,
a stroke and pulmonary embolisms and cardiac events. And they can do that a bit more quickly than humans can, and on top as
Mm-mm.
well. So it's humans looking at it as well as this AI. So it's an additional tool. I think they're expanding into other areas too, and it can just get the
Mm.
alerts to the right specialists more quickly, where
Amazing.
time just really matters.
Amazing.
And then there's
Cool.
Tempus, which is a multimodal fusion between clinical notes, imaging, and genomics. And they
Mm.
do pattern recognition across all sorts of data layers. So they seem the sort of the broadest view. So
Mm.
yeah, so
Wow.
this isn't consumer hype AI, it's clinical pattern recognition. And
Mm.
the important thing here is the reason why it's so slow is that in healthcare, hallucinations aren't a bug, they're a huge risk. And
I mean, yeah,
the
100%.
they're pattern recognition layers that are sort of quietly sitting inside the system, working alongside humans for better outcomes. And the way that I like to look at this overall when I've been reading about these is
Mm.
so do you know the Swiss cheese model in safety science, right? Where every
Mm.
layer that you add has
Yeah.
different holes, but as they overlap,
Yeah.
it just becomes more and more secure. And I
Yeah.
see these tools as becoming another layer in a sort of healthcare safety
Yeah.
net.
That makes sense. That's a very additive mindset as well, right? Technology doesn't solve all the problems. If you try to position it as kind of like it does everything perfectly, then you start to get into this weird space of like, okay, so then why do you need a human doctor, etc.? And that's not a really constructive way to look at it. So I think that's a really great image. Also, if people don't know the concept already, like it's very, you can very quickly kind of figure out like, yep, different sources of input. When you put it all on top of each other, it forms like as complete of a picture as you're going to get. And it's diversity of perspectives, be it from an AI or from humans, is always a good bet. So I think that makes a lot of sense. I'm curious. So since you have a lot of hands-on kind of experience in the space, and you also know a lot of folks that work in this space, from a product perspective, I think we've talked now in our chat about we've talked about trust a lot. We talked about how important and private this data is. And I'm curious if you were to kind of articulate some key themes for any folks working on working on product, working in the on products for the software, especially pattern detection software in the medical for medical practitioners. What are some of like the key themes or kind of takeaways that come out for you like as being the most important?
Yeah. It's so important, and it's definitely in my wheelhouse to talk about the design of privacy, consent, and trust, and how we interact with these tools
Mm,
and how we give people utility and control.
mm,
So for me, as I said before, healthcare data is the most sensitive data we can produce.
mm,
So the trust bar has to be much higher on multiple
mm,
levels. So
mhm,
the takeaway number one, the subject number one would be that privacy must be the default, not an option. So by that,
mhm,
I mean the data that we collect has to be as minimal as possible while being sufficient. So we don't take unnecessary additional data. We need to have
mhm,
and communicate that we're doing local processing wherever possible and not, adding the
mhm,
risk of these things migrating out. And if they do, that we communicate how that's done, that there's
mhm,
no secondary use without explicit consent, so that we communicate to people and give them control what
mm,
happens with their data, and that they understand it, and that there are clear boundaries. So it's clinical use only, not commercial use, and that is
yeah,
clear, ideally, even from a legislative point of view. And that we make the edges of the data system really visible and understandable and not hiding behind jargon, which leads me to the second, number two
mm,
takeaway.
mm,
Consent has to be contextual and not
yeah,
legislative. So no walls of hiding behind legalese amounts of text, plain
yes,
language. Let users set the granularity of their sharing and understand how they're setting it. Don't overwhelm. Don't ask them about every little thing, because once you have 100 questions, you don't even like it, it just gets too much. So think about what you're asking, when you're asking it, and how much you have to ask in order for them to
mm,
be in control without tipping into dark patterns of asking too much.
mm,
Give
mhm,
people revocable control. so that I can have a
Mm-hmm.
dashboard of so I can see what kind of consent have I given? Where is my data going? Can I take it back when I'm done with
Mm-hmm.
a particular
Mm-hmm.
process?
Mm-hmm.
And show exactly what data is used to produce a specific insight, right? So that I
Mm-hmm.
also understand, oh, this isn't just out there and doing something, I don't know what and where, but actually tie it back to that data so I can see how it's benefiting me. And then
Mm-hmm.
takeaway number 3 is that trust comes from explainability and alignment. So by that
Mm-hmm.
I mean, so leading from that last point, show the reasoning. Here's why we think
Yeah.
this is a risk.
Yeah.
Show the evidence and the guidelines. Make the uncertainty visible. How much, what does this mean? Like, if there's a risk increase, that can sound really scary. Put that into context for people to understand who aren't
Mm.
coming from a data science background. And also do human in the loop by default. There always should
Mm.
be a human here. And so that doesn't necessarily mean that you have to have a clinician that's always the gatekeeper, but
Mm-hmm.
have a really clear handover between the machine insight and human judgment. So if that
Mm-hmm.
means that people get information from, say, an app or a dashboard, there have to be rules that explain what is shown and how, and focus on providing understanding, not data. Understand how, sort of sit next to the person and help them understand and give them context in a way that is, that
Yeah.
allows them to understand it and make it easy for them to speak to a
Mm.
human if they're unsure. So
Mm-hmm.
I think
Mm-hmm.
that in
Mm-hmm.
in healthcare design, trust isn't a feature, it's an environment. And if
Mm.
people understand what a tool is doing, why it's doing it, and who's accountable, then trust can follow and they'll be more likely to use this and actually have the benefits of using them.
Yeah. 100%. I think all of that is all of those things honestly sound like pretty good product principles and design principles to have in mind anyways. I think the from everything you said, the one kind of build I would add on to this, especially when it comes to kind of clarity, right? And not putting walls of text or analysis around consent, sorry, walls of text around consent, walls of text around analysis, and also the language that's used. Like one has to really qualify risks and like I'm going to go all the way on like a very micro design level. Like when something truly is concerning, worrying, utilizing colors, utilizing like really like a state of like, hey, this is concerning. Talk to a doctor right away versus like, hey, this is something you should know, not concerning. So, because even like phrases like risk moderate, that can be interpreted so many ways, right? And that would be worrying to me if I saw risk moderate. But to a clinician, that might be like, listen, that's yes, that's all that's a possibility, but it's 1 in 500,000 people get that. You know what I mean? So language and education, coming back to the early point around education, really, really important. The platform I'm working on, this is exactly it's not in the medical space, but this is exactly the topic that we had to wrestle with, right? You have a choice always, just like, do you just give all the data, all the information that you possibly could give to a user? Or do you actually find a way to guide them through that data and create an experience around it, right? Because when you are, let's say, whatever pattern recognition has happened based on blood tests, blood panel, there's a way you can have people engage with the results in steps, in an experience. It doesn't have to just be we're figuring out all the things and then here is your report. It doesn't have to just be a wall of analysis. Like you can, from a technology and from a design standpoint, you can have fun with it and it makes it less of a scary experience. You just have to believe that it's possible to make data kind of engaging and interactive. And yes, you want to make sure that, you're not making anything obscure or creating confusion, of course, but it really is a design principle to create an experience around data and not just kind of throw all of it out. And I would argue this is not only is it important for a patient, also for a clinician, right? You don't want to give them more admin to work through and read and analyze and everything. You want to give them the information they need right away in that moment, in that context.
Yes.
So everything you said really tracks for me. And I think it's applicable to many, many different industries, to be fair. Yeah.
It's going back to design principles that are universal. And I mean, another thing that I didn't mention that I realized while you were speaking is that you design for different people to have access to
Mm.
different levels of information, right? You want your top
Hmm.
level
Yep.
overview that says something, and that is the right one for the top level context.
Yeah.
And then
Yeah.
there's people who will want to maybe that level is enough for them. And there's people who want to have more information, and to think about how you place that information, that you're both
Mm.
learning as well as action points, and that you make
Mm.
it so that people can make it their own and find to the level that they need to feel better about the data that they're getting, and also that they can,
Yeah.
if something needs to be an immediate action, like you say, that you raise that. So it's about thinking about what layers are people going through as they're taking in new information potentially. And that applies to
100%.
consumers as well as, or to patients as well as clinicians.
100%. And the last thing which I think is really important to mention is that there's always an opportunity. So where technology can really help the IRL experience of a patient and a doctor working together is it can help each party with what the possible next step is or what the bridge is. So for example, you go to you do a blood test, you go to the doctor interprets the results. It's a lot of information. It's a lot going on. You maybe don't think of all the questions you want to ask. There's certain things you want to go over again. Sometimes they just flash your results to you. They don't actually like share them with you, or it's in this like always this very convoluted printout that makes sense to a lab, but maybe not so much to you. And this is where the technology can help support and educate on what the doctor has said without hallucinating and adding additional context, but also vice versa, right? If the patient has all this data with their wearables and they've gone and done whatever testing on their own, the 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 software can produce a bridge to like make it as easy as possible for the patient to articulate what they've learned, what they're seeing, and where they have questions. So it doesn't have to be one against the other, to the point of what I was saying earlier about advocating for yourself, trust in medical professionals. It can be a bridge in helping, get to the core concerns or to educate outside of that context of like the doctor only has 15 minutes to explain your results to you. So I think there's really beautiful opportunities to build trust between patients and doctors themselves, let alone building trust with your data, you know?
100%. So I think that's a brilliant summary and vision to what these tools can do, and in a way that kind of leads to where all this is heading. And I
Mm,
think we are at a technological inflection point that makes it look like sort of that can makes it look like healthcare can see ahead as opposed to react, right? So
mm-hmm.
it almost looks like we're
Yeah,
looking into the future. And I
yeah,
think this isn't machines diagnosing everything by themselves. I think that's the point that you make, that it's,
mm-hmm.
of that layer of trust. If they're designed well, they can build this additional layer of trust. I think it's humans and tools seeing patterns together between
Sure.
patients and clinicians, and that in between communication. I love that point that you
Mm-hmm.
made. And I think it's important to also know that clinicians still interpret and contextualize and make the right calls, and that it's not us doing some self-service on our own and kind of, the sort of
Yeah,
Googling our symptoms on
yeah,
steroids.
yeah.
And I think these systems simply widen the field of view, and it's
Mm,
not replacing judgment, it's expanding it. So maybe
mm,
looking at it from the sort of on three levels. For patients, it means earlier detection and
mm-hmm.
earlier action. For
Mm,
clinicians, I think
mm,
it means earlier signals, safer
mm-hmm.
decisions, and
Mm-hmm.
also a trust arm, like you described,
Mm,
to
mm,
their patients. And I think
mm,
overall for the system, it's a shift from being reactive to
mm.
a more continuous anticipatory care, which I think it makes a huge impact. So I don't
Totally.
think we're predicting the future as such. We're preparing for it. And
Mm-hmm.
generally with sort of generally these concerns around these tools, I think when humans see more, they act
Mm.
earlier, and
Yeah.
tools don't replace instinct, they can just extend it.
Yes. Yes, I think that's really well put. And I would say at the end of the day, no matter how perfect a tool is or an LM is in pattern recognition, it can never be held accountable. So to the point that failure is harm, a doctor and a medical professional has to be the one that does the final kind of, or the patient themselves. You know what? I'll even say it's the patient themselves. Also, they can advocate for themselves and say, I believe in this course of treatment, or I understand these results and I want to act on them, or I don't. It's your body. You have to decide this, but it has to be up to a human to make the final connective dots. So I would just say that I would add like a note to anyone who's working on like design, doing design work for such products. Like in terms of language, it's really important not to present overconfidence in any shape or form. It always in big, big letters. Confirm this with your doctor. Do not act on this without medical advice, even if it feels like it's harmless and innocuous enough to take action on. So I think that's a very important reminder again for and a guardrail for technologists. The technology cannot be held accountable when harm is done. Therefore, it's a human that has to be the final decision maker on how to interpret the results.
Yes, absolutely. And I think it shouldn't be ever alarmist. It should be, here's something, have another look or do another
Yeah.
test. And
Yeah.
so
Sure.
both in terms of language as well as what the recommended output should be that
Sure.
people should do with it. So always
Sure.
bring it back to, here's something for you to think about,
Mm,
to look into, to do. But that's a
yeah.
really good point of the framing of building these tools. I agree.
Yeah. Wow.
Wonderful.
Super interesting.
Yeah, I think it's super fascinating for just us as people to see what's
Mm,
changing in this space. So it's been really great exploring it with you.
I'm really enjoying the series. I'm learning a lot from you. And I think it's cool to also be talking about technology in the context of tools that can actually save lives and help people feel better and help them recover from sickness. So I'm really feeling this series and I'm looking forward to the next one we do.
Thank you so much for being part of it. It's great.
Pleasure as always.
See you on the next one then.
See ya.